please welcome Angelina Bless, Bethany Ray, Ricky Williams, moderated by Dr. Michael Hart, the Exercise and Recovery, Understanding Your Body and Its Relationship to Cannabis panel.
Okay, so this is the Exercise and Recovery panel for cannabis. So I'm just going to ask everyone a few questions. So, Bethany, I'll start with you. You started hosting cannabis-friendly fitness classes as part of work with Flower and Freedom. Would you tell us a little bit about that?
Yeah, absolutely. So my name's Bethany Ray, for anyone who missed that. I started Flower and Freedom, a lifestyle brand. I'm curating some of the best of cannabis for the health-conscious consumer, and I'm bringing that to you in authentic, experience-based content. So part of creating that content, I decided to combine my passion for athletics, sports, and exercise with cannabis, and I started some Flower and Freedom fitness classes in Vancouver. I'm using some event space at some of the nice cannabis dispensaries. And at these fitness classes, we do yoga, Pilates, dance workouts, boot camp, and no consumption is facilitated or supplied at these events. For me, I really wanted to create a place that was a safe place for people to come and learn about how cannabis can be part of an active lifestyle, to share some Cannabis 101. So a lot of the people that have been coming to these classes are not yet familiar with the difference between THC and CBD. And I take 5 minutes at the beginning of each class to teach them some cannabis basics that I've learned in my cannabis experiences, and perhaps share a product or service that is an alternative to smoking to really show them that cannabis can be it can work with their needs, and it's really a personal experience. So I look forward to doing some more of those classes in Vancouver and around Canada. I hope I can see some Flower and Freedom fitness classes in Toronto soon.
Yay!
Okay, well, thank you for that response. It was excellent. So, Ricky, my next question is going to be for you. So, when you were playing in the NFL, did you use cannabis as a recovery drug? Did you use it as a performance-enhancing drug? And how did you exactly use it?
Good question. So we got to go back in history a little bit. So I started using cannabis back in 2001. And at the time, outside of California, in the States at least, there wasn't very much talk about any positive benefits from using cannabis. So I was pretty much on my own. And what I noticed is a friend of mine got picked up by the Saints and moved into my house, and he was a smoker. And so I started smoking with him. And I'd noticed after work, after a hard day of football practice, I would come and I'd use cannabis. And I noticed that I felt better. But at the time, everyone on the team was on a nightly prescription of Indocin or Toradol, strong anti-inflammatories. So I remember one day sitting in the locker room and watching players come in one by one for their Toradol shot or their pill. And I started thinking, I wonder what that's doing to our liver to have to be able to have to take a pill every single day for 6 months. And then I decided, I'm going to do an experiment and see how long in the season I can go without having to use anti-inflammatories. And so I started using cannabis instead after practice. And I noticed a couple of things. The first thing I noticed was when I would take an anti-inflammatory, I would come home and I would just play video games and the pain would go away. And I noticed when I started using cannabis, I wanted to get on the ground and I wanted to lay down and I wanted to stretch and I wanted to be more in touch with my body and work on myself. And I also noticed that, at night when I'd lay there, I'd start thinking about, okay, what are the things on the field or in my life that I would like to improve. I started coming up with ideas of how to be a better football player. And so I think it has the potential to make you a better athlete if you combine it with a mindfulness practice or yoga or stretching or Pilates or some kind of movement, but not in and of itself. And I definitely use it for recovery, physical, mental, and emotional recovery. It's one of the things about something like football that it's a grind, and every day you got to go, and we get 1 day off a week. We play 16 games. It takes a toll on your body. And I noticed using cannabis, I had more energy consistently throughout the season. And the other part of the story is I was actually failed the drug test in the NFL for cannabis and was put in the NFL's drug program, which meant I was tested 9 times a month. And so I had to alter my cannabis use. I tried to stop using it, but I realized after using cannabis to play football and the quality of recovery that I got, it was difficult for me to not use it because my other alternatives, was strictly altering my diet or going back to pharmaceuticals. And so I got down to, I realized, okay, if I'm in this drug program, I had to really limit my consumption, and I still found amazing benefits.
Thanks for your response, Ricky. And I just want to point out something that I mentioned in my keynote speech earlier, is that there was a study that came out this week in the British Medical Journal. We were just talking about anti-inflammatories. And there's a big misconception, and I've been guilty of this in the past, in thinking that anti-inflammatories are only detrimental if you use them chronically. But this is actually not true. If you use anti-inflammatories, even Advil, for 1 week, it can actually increase your risk of a heart attack by 20 to 50%. Wow. So that's something that I really want everyone to remember here today before they start popping Advils in the future. So our next guest is Angelina, and she is a professional Muay Thai fighter. And my question for you, Angela, is what particular product have you found to be best for recovery or for improving performance?
Can I say weed? Yeah. Sorry, smartass. Basically, it started as me just trying to find a way to help myself recover. And because of being a Muay Thai fighter, you don't have to make weight or anything, right?
Well, I don't have to make weight, but we have weigh-ins every Friday, and we're fined $150 a pound. We're over.
Okay. So for me, it was about being able to consume cannabis in a healthy manner. So I started making cookies. I was giving them to all the Muay Thai fighters, and it was going really well that way. But I was still finding, and what we know is that sugar is adding more inflammation to the body. So I wanted to go about it that I was able to have a good treat, get the medicine into myself, but not be able to throw my weight off at all because I had weigh-ins to take into account. For myself, it was I was trying not to take Advil as well. I've had numerous injuries, so I just really wanted to, I started with edibles. It's 1 square of chocolate. I know my dose, and it's about helping people to find their dose to really be able to get the best recovery.
Okay, so Bethany, my next question is going to be for you. And Bethany, as a medical cannabis patient, how does exercise and cannabis go together hand in hand for you?
This is a really personal question for me, actually, because my cannabis use as a medical cannabis patient is really truly for anxiety and mild depression. And I've really, all of my life, treated anxiety and depression with exercise. And cannabis is now part of that. But actually, I think cannabis is helping me become more self-aware and wanting to dig deeper into the anxiety and depression that exists and heal it at its core and not just cover it up with exercise and cannabis. So for me, exercise is a really important part of everyone's lifestyle. I don't think, for myself at least, that I could come in and expect cannabis to heal all my issues or solve everything for me if I'm not taking care of my physical and mental health in the other ways that I can do that, with exercise, with self-care, self-love, being compassionate with myself. So it's part of the process that I'm on is working in healing myself, but exercise is a really big part of dealing with anxiety and depression, and that's why I'm combining it in the classes that go hand in hand, talking about healthy cannabis consumption, safe consumption to deal with anxiety and depression, and hoping that other people along the way can learn from some of the experiences that I'm having, because I think that it's a very personal medicine that we're dealing with. Cannabis, it's not a one-size-fits-all. So
I'd like to piggyback off that, and it's not directly speaking about recovery, but at the same time, I mentioned earlier that I started using cannabis. I was diagnosed with social anxiety disorder, and I started taking Paxil, and I noticed taking the Paxil, I just felt a little bit off. and also in dealing with my anxiety, I got off Paxil because when I did use cannabis, I was able to go deeper and work on the root of the anxiety, and it really was very powerful and really changing my life dynamically.
And on that note, Ricky, I think this is a good time to actually bring up. So sometimes when people use cannabis, they can have a paranoid effect or a paranoid experience. And I know we're talking about the exercise panel today, but given the stories that you just discussed, do you believe that cannabis is something that can help you delve a little bit deeper into perhaps reaching your problems, and perhaps that paranoia is something that's actually good? Maybe it's surfacing something that you need to deal with, and maybe these medications like Paxil, they do not provide that. And if you use Paxil and you get benefit, that's great, but I don't think anyone who's using Paxil is going to be able to dig deeper. They're not going to get a paranoid effect that's going to surface something that they need to deal with. And do you feel that you've had the same experience, Ricky?
Yeah. So it's what we're talking about. I think cannabis is a wonderful tool, but if you put a hammer on the table, it's not going to do anything. You got to pick it up and use it skillfully. And I think cannabis is the same way. I think my whole life I've been more of an introverted person, more of a reflective person. And so being successful in the football world and all the attention, was great some of the time, but I felt a lot of times it wasn't honoring of my introverted nature. When I started using cannabis, it's a plant, and I feel as a plant it was honoring my internal nature, and I got a chance to, in that space, to work on myself so that I was good inside. And so when I went out in the world, I just felt better about it. And I think you bring up a good point. It's about safe use. It's about consciously, effectively using cannabis to increase the quality of your life.
And would you say too that, Ricky, just to go a little bit further on the Paxil, so if someone has depression and they take Paxil, do you feel that Paxil may just numb them, or it might get them to a point where they feel comfortable, but they don't have to deal with their problems?
It's just shutting off that part of their brain. It's not necessarily dealing with any of the issues. And sometimes when people are smoking cannabis, they're able to really feel the things that are bothering them. So there are paranoid episodes, but I think that if people are more educated on the kind of strains that they're using, we were just talking about there's strains like Medihaze that are 1-to-1s. That can help people a lot more. It might be a sativa base, but you're getting more of the CBD, more of the medicinal benefits. And the difference in THC percentages from like the 60s until now has more than doubled, where Woodstock weed is like 6%, and now we're like high 20s sometimes. So that is too much for people, especially that aren't familiar with it.
Well, I agree mostly. I'm just gonna go off a little bit here. Is for me, my sense is people that struggle with cannabis, it's more of a spiritual issue than anything, about opening your mind and how open are you willing for your mind to be. And I think I see some people who've tried to control their life and live their life in a small box, and when they use cannabis and they're aware of what actually exists outside that box, they have a difficult time dealing with it. And I have friends, meditators, very spiritual people, where it seems like it doesn't matter how much THC or whatever is going on, they're able to still, because they're used to functioning in space with outside of their little box, and I find they do extremely well with it.
Okay, so my next question is going to be for you, Angelina. So can you explain sensory deprivation? And my question with that also is, do you use cannabis before you get into a sensory deprivation tank? And what are the differences when you go into the tank without cannabis and when you go into it with cannabis?
Well, it's my journey with Float Toronto started when they opened almost 3 years ago. And basically, like Ricky, my sport is extremely aggressive. It's very, I've had every injury known to mankind. So I can deal with the injuries, but then it became like mentally draining. My cortisol levels were shot, my adrenal fatigue. I was getting injured. I wasn't understanding. I was having like breakdowns and depression. And so I just needed to slow it down. So I met the guys at Float Toronto, and basically what it is you're stepping into a bathtub that is 11 inches of water, and it has 1,000 pounds of Epsom salt. So in that 1,000 pounds of Epsom salt, you're getting all the magnesium. But not just that, it's a completely dark space. So even sitting here comfortably, there's lights around me, there's people, there's cameras, there's noise, and it just shuts that all down. So we're on our phones so much, we're totally taxed mentally, physically. So getting into that tank, you're at full weightlessness, and it allows your body to get the rest that it needs. And that's what I really found with my training. And once I started using cannabis, getting in the tank, relaxing, even just like 1 hour a week, it's amazing. It's a cell phone-less environment. You know, you can't Instagram. You just actually have to like treat yourself and like find your, you know, like I think of so many crazy things in there. Anything from fight technique to how to make better edibles to just letting go. And that's something that we're not doing. Do I use cannabis in the float tank? Absolutely.
Yes.
I have a little prescription that I've kind of figured out for myself. So I'm taking my milligram dose of edibles, and then I'm smoking like CBD strains before I get in. I'm finding that sativa strains don't work as well because it makes me a little too active in my mind, unless I'm really wanting to figure some stuff out. And that's when I would do more sativa based. But edibles in the float tank, it's already opening up the natural DMT part in your brain. So that with edibles, I find I have extreme hallucinations, and like it's being at complete weightlessness with no stress. So it's absolutely healing. You're getting the rest and recovery that you need. Yeah.
And as these sensory deprivation tanks are becoming more and more popular, I first learned about them in around 2011 on a Joe Rogan podcast, and I had my first experience around that time. And I know that in London, that's where I'm from, London, Ontario, we only had one center at that time with one tank, and now we actually have a couple more centers that are opening. So I think that the things that are being discussed today are definitely going to be brought into the media a lot more, and you're going to see a lot more people utilizing sensory deprivation tanks because they can actually be an extremely, extremely effective tool. So I'd encourage anyone to use them if you want to do some deep work.
I was just thinking about when I came in on the last panel, I came in towards the end, and they were talking about cannabis and sex, and I was thinking about recovery. And this conversation is making me think there's a lot of things that we can do to increase recovery, to increase that time where our body's not stressed out or doing something, and sex is one of them. And I realized that cannabis, because it's for me one of the things that cannabis does, that it can also go synergistically with yoga, Pilates, exercise, when you're really moving and functioning from a deeper level of stillness.
Yeah, and you'll find too that if you do, there's actually an inverse relationship between testosterone, DHEA, and cortisol. So meaning that the lower your stress levels are, the higher your androgen or testosterone levels are going to be, and the higher your sex drive is going to be. So if you find that after you do yoga or after you meditate, that your libido has just gone through the roof, it's probably because you've done something to change your physiology, and your hormones are now prone to actually be more, to have a higher libido.
Thanks, Dr. Hart. That explains a lot.
And then we only have about 5 minutes left, but I really wanted to pose this question to Ricky because I think it's very important. Ricky, if cannabis was allowed to be used in the NFL, do you think that would curb the opioid epidemic, and do you think that it would help out a lot of NFL players with addiction?
So players who have a lot of pain they have to manage, what are they going to do? And I think when cannabis becomes a viable choice for them, guys aren't going to want the opioids. I mean, I just hear guys complaining about constipation, and they don't like the way they feel, and they feel like junkies. So I think with better alternatives, I think guys will definitely, and education. I think that's the other point. Most NFL players, most of us, right? We grew up in an environment where cannabis is bad, and so we're having to unlearn all that, and just to get to neutral, so we can actually register what our true experiences are like right now. So I definitely think it would help.
And Angeline, I'm going to ask you the same question as well. Do you feel that if cannabis was allowed in organizations like the UFC, do you feel that it may help with things like traumatic brain injuries? Do you think that it would curb some of the addictions that some of the fighters do have?
UFC has just changed their laws, so they're actually allowed to consume cannabis up until I think it's a few days before they fight, which is really amazing. When I got my last concussion, they tried to give me every painkiller known to man, and I refused it all. So I treated myself completely with THC, CBD, and sensory deprivation, and that had the best results. So I was going home and taking a pill every day before I came. So it absolutely will help in all realms of, I think, people, athletes' worlds. I think that once we really begin to open up the doors of cannabis into athleticism, that athletes will be more well-rounded. They'll be getting the rest and recovery that they need, and they'll be able to train, treat, and repeat. And that's important for us, that we'll have longer lives as athletes, and because if we are resting and we are recovering, then it's gonna make us into better humans, really. But.
Ricky, I think you had something to say.
I had something to say. Always, right? I'm just agreeing. You know, I think this is important. You know, the panels like this and discussions like this. I mean, it's kind of a side story, but I remember when I got suspended by the NFL, or it came out that I used cannabis back in 2004. It was the first time that a lot of sports writers got to write about marijuana, and I could tell how cathartic, and just for people to be able to talk about it. You know, and to be able to come to a space where you don't have to be ashamed for something that is beneficial to you, I just think it's good. So thank you guys all for being here. Yeah.
Thank everybody for coming out today. Is there anything else for the panel to wrap it up? We're at our time. Any final words, comments from the panel or moderators?
I think the key to exercise with cannabis is taking the time to personally understand what the cannabinoids are doing in your system and figure out what's the best for you. It's a very personal experience.
Yeah, just to piggyback on that, that's what I wanted to say also, is I think the one thing about cannabis, what it did for me in the NFL, is it put my treatment in my hands instead of having to go to the doctor. And all the doctor said, he said, regardless of what injury I had, the doctor said the exact same thing every time. Take it easy in practice. Let me know. I'll tell the coach if you can't practice. And here, take these.
I'll just say that on that last note, I think that cannabis is not a performance-enhancing drug, but it can, in fact, get people moving again, and that's the message that we need to get out there. There's too many people who think that cannabis is just for people who smoke pot and sit on the couch all day. Smoking pot doesn't make you lazy. Being a lazy person makes you lazy.
Absolutely.
So if you want to stop being lazy, then just stop being lazy. And that's the way to do it, not by stopping cannabis. There's lots of people who use cannabis who are very, very active all the time.
I started a running group in Parkdale called the Ripped Runners. So we're now doing long runs after ingesting cannabis, and some of the longest runs that I've been doing have been smoking cannabis and ingesting it. So there is a whole other subgenre of athletes that are out there that are just starting to really talk about it. I have clients that are, or patients that are jiu-jitsu fighters. I have football players. I have MMA fighters, and everybody's really now coming out and talking about how it really helps their sport and survival.
It's amazing. Thank you.
Thank you.
Thanks, everyone.
Thank you, guys.
And ladies and gentlemen, thank you very much. Another hand for all of our panelists and everybody who spoke today.